Welcome back to the show, Talk with Your Doc. With me is Dr. Abu Bakare, an endocrinologist here in Thunder Bay, Ontario. And we were talking about diabetes mellitus and various risk factors. Dear Dr. Bakare, we were talking about obesity and diabetes, and you mentioned that obesity can lead to insulin resistance, and more insulin has to be produced by the pancreas, leading to aggravation of the diabetes. Are males and females, is there any difference in the getting diabetes?
Well, in general, females appear to have more incidence of diabetes, but in most population, actually, they are probably equal if you study it very well. Mm-hmm. There is a tendency in diabetes, as seen, for example, even obesity, that the female is more likely to seek medical attention than the male is. Right. So, in fact, it looks like we have more female diabetics than male diabetic patients.
Right.
So that's and you know that obesity is also more common in the diabetic, in the female diabetic.
Right.
There are other risk factors, for example, gestational diabetes that you see in female, you don't see in men. So there are other factors that sort of promote it slightly more in females than in males.
You mentioned about gestational diabetes. Yeah. Who gets this gestational diabetes?
Well, the gestational diabetic patient, again, the predisposition to get it include, number one, obesity again. We always come back to obesity, a family history of diabetes, conception at a later age, mm-hmm. A background history related to certain medications may in fact predispose a patient to developing gestational diabetes. And also if you have twins, you are more likely than if you have a single pregnancy. So these are the factors in particular that may promote the development of diabetes.
Gestational diabetes is when you get diabetes during the pregnancy period. Now, the blood sugar goes high during the pregnancy.
That's correct.
After the pregnancy, does it come back to the normal?
Yeah. For you to actually classify as gestational diabetes, it has to be during the pregnancy, particularly after the first trimester, and it has to disappear after the pregnancy. Otherwise, it's truly not gestational diabetes, because we have what we call type 2 diabetes in pregnancy. In other words, it's the pregnancy that brings out the type 2 diabetes. So if we see a patient who is diabetic in the first trimester, it is likely that the patient has type 2 diabetes. It's just it came out because of the pregnancy and the associated abnormal hormones that occur during the pregnancy.
So somebody has a diabetes during the pregnancy, and it comes back to the normal after the pregnancy. What are the chances that patient gets type 2 diabetes in the future?
It's higher than the normal. Again, it's around 30%. The patients who have gestational diabetes who are followed for about 5 years, almost 30% of them will become truly diabetic.
So they need to be followed up over the period of time?
That's right. So we usually recommend that the patient is seen at least 6 to 8 weeks post-delivery to make sure that the blood sugars have normalized. Otherwise, they may in fact retain the abnormality and have to be followed up for it.
Now, pre-diabetes, diabetes type 2, and then gestational diabetes, what sort of investigations are needed to diagnose it at early stage and follow up?
Now, for you to make a diagnosis of diabetes, you have to have a few things. Number one is, as I said, the fasting blood sugar should be 7 or more on more than one occasion. So you'll truly be diabetic. A single blood sugar, we call a random blood sugar of more than 10 millimoles is regarded as being diagnostic of diabetes.
Right.
And then what we call the hemoglobin A1C is a test that sort of gives us an idea of what the average blood sugar has been in the previous 3 months. And if the A1C is clearly more than or equal to 6.5%, then you are likely diabetic.
Okay.
So those are the definitions. So in fact, you can look at diabetes. It's a definition. So it's only when you achieve those levels that we really should classify you as diabetic. What we didn't mention is that for you can also have what we call glucose intolerance. In other words, somebody suspects you are diabetic, we give you glucose to take, we do your blood sugars 2 hours after, and it should reach a certain level. It should not be more than 11 or 11.1, and if it is more than that, then you're truly diabetic. If
Right.
it's between 7.8 to 11, you have glucose intolerance.
Glucose
Okay, you are not diabetic yet, you
Right.
just have glucose intolerance. So they are more of biochemical or physiologic definitions
Right.
than the way you look or what happens. Of course,
Now,
you can have symptoms.
Those
yeah.
were like for the blood sugar.
That's right.
And then one monitor it by checking urine sugar levels?
Urine sugars are pretty useless.
Okay.
Okay, they are not. They do not correlate well with the blood sugar. In the past, very many years ago, when we didn't have means of measuring glucose very easily, and
Right.
we used to use glucose in the urine. To decide, but they are pretty crude and not
Crude.
really.
So blood sugar is the most accurate.
Is the
method.
most accurate way of diagnosing.
What is the accuracy of getting the blood sugar by the fingerprint method, and there are instruments available in the market? Are they sensitive and specific?
Extremely. The new meters are so sensitive that we usually expect them to be less than 1 millimoles difference between what they give you, if they are accurate, and the actual blood sugar measurement.
So they are recommended.
They are recommended, highly recommended.
So how often one should check the blood sugar when if it is pre-diabetic, and how often one should check when it is diabetic type 2?
Well, I mean, if you're pre-diabetic, one would probably recommend that you check your blood sugars maybe a couple of times a month until we are sure where you are, but no more than about once or twice a week. I mean, for the pre-diabetic patient. Now, the diabetic patient, it depends. Now, the diabetic patient who is just on oral hypoglycemic agent, who is not on insulin, because you can be on insulin, probably requires to do, we will say, at least 2 blood sugars twice a week, at least. Because you need the blood sugars to give you an idea of where the blood sugars are pre and post meals, and you can stagger them. You don't have to do all of them in 1 day or 2 days. So that's for the type 2 diabetic patient, just an oral hypoglycemic agent. Those who are on insulin 4 times a day, will require quite a bit more.
Okay.
Because you want to be able to check to make sure that they are not low or too high,
right,
pre or post.
So frequent blood sugar monitoring is a very important tool in the treatment of
that's right.
Diabetes.
That's right. I mean, you have to know them to know which drugs are most applicable in the situation, and which drugs are not acting well, or which drugs are being excessively overactive to cause hypoglycemia.
Right, right. Now, what are the signs and symptoms if I have a pre-diabetes and if I have a diabetes?
Okay. If you are pre-diabetic, you may in fact have no symptoms whatsoever. You may notice that you are a little bit tired, or if the blood sugars actually go up, but you may have no symptoms. The truly diabetic patient will have symptoms of what we call polyuria and polydipsia.
Polyuria.
Which means they pass a lot of fluid. Okay. The reason being that if your blood sugar is high, it causes osmotic diuresis. It makes you pee. I mean, essentially, it makes you pee liquid out. And if you, of course, pee a lot out, then you will feel thirsty by natural instinct and physiology, and you'll drink a lot more. And you'll notice that you are going to the bathroom and drinking a lot more. And then as time goes on, you'll find that you are losing weight, as a result of wasting away a lot of sugar and calories. And if it persists, you may get an infection, because particularly in the female population are more likely to get an infection because of excessive urination and of course sugar in the urinary pathway. Okay, and if you really get bad enough that your blood sugars are at a certain level, you can go into coma and die from it.
Wow.
So
lots of signs, symptoms to look for.
That's right.
We'll take a short break, Dr. Bakare, and we'll come back.
Thank you.
Please stay back for the next part. Thank you.